So Waves of Health is it's a nonprofit organization, and the main mission is to provide free medical and pharmacy care to underserved people in the developing world. And since 2007, we've been going to the Dominican Republic to Dajabon to support 3 clinics and 1 nursing home, and we set up a basic primary care clinic. We take over. There's these little freestanding clinics that are government sponsored, but they're staffed by a recent graduate and 1 recent graduate for the community, which means that it's limited hours, and also it's limited supplies, and the equipment there is not fully up to date as you'd like. Plus, the supplies are limited too, depending upon what's available. So we go there and we set up exam rooms. Each doctor has a box of all their equipment they're going to need, and we set up an exam room, which often is just a table, a chair, and an exam table, which sometimes is nothing more than 2 desks put together sometimes, unfortunately. And then they start to see, we have a triage set up, and patients are brought in, and their height and weights are done. And for the children, we give the mothers a height and a weight chart to use so that they can make sure that the children are at the proper height and weight and growing properly when we leave. And they can keep continuing that. And then we see the patients, see what their problems are, and then they go to our pharmacy. We bring a full pharmacy that we set up in a different part of the clinic in a separate room. We set up a full pharmacy. Part of our group is pharmacists, and they're also counseled on how to properly take the medicines and what to do about them. Actually, Dr. Jimenez insists on that because he realizes that the patients there, their education level isn't as high, and sometimes isn't as high as we expect. And each year we've gotten more efficient, and we see, typical conditions that you would see in the United States. I mean, after all, people are people. People get hypertension, diabetes, asthma, coughs and colds, allergies, things like that. But we also see some tropical diseases too. The biggest one is probably some intestinal parasites. They're still prevalent because 2 of the communities we go to, there's no sewage system. Most of the patients all have outhouses, latrines. So only one clinic we go to is the community there that they have indoor plumbing. So intestinal parasites is a little bit of an issue. There's a lot of skin infections and skin conditions because of the hygiene and the fact that it's tropical climate. Patients their access to actually proper footwear. We've started to bring flip-flops with us. We realize that a lot of, especially little kids, the shoes are not so good, and so we've started bringing flip-flops, in which the little girls love them. So we try to give them all some flip-flops so that their feet can be protected. For the last mission we went on, which was in May of 2011, we saw about 1,200 patients. Some of them were sick people, and a lot of them, some other people were just for checkups. And one of the things is that we see a lot of children for child exams. And if you think about it, I mean, these people they don't have access to good care, and if a team of American doctors are there, they want their children to be checked just like anyone else, any other mother would want their children to be checked. So we, check them out, make sure their heights and weights are good, make sure they're healthy. And luckily, the Dominican Republic is an agricultural country, and we go to these farming communities, so malnutrition or starvation is not a problem at all. Malnutrition isn't that big of a problem either. In this next mission, we're in November, we're going to add some surgical services. The secondary goal is to educate, Americans and Westerners about the healthcare problems in developing countries. Since our organization is sort of based out of and started at St. Michael's Medical Center in Newark, which is a major teaching hospital, we have a lot of residents and a lot of young doctors that come with us, which I really like that we get a lot of young people to be involved, and their energy is infectious. It keeps me going.